It has added self-confidence. That was the missing piece to my face being aligned. So when we corrected my chin to be more in line with my nose, my lips were too small for then the whole side profile.
Don't just augment lips. When I first started, I did used to think that people would come in for lip treatment, I should put a mill or filler in their lips. And most of my patients were happy. But the truth is I missed a lot of easy wins for patients who weren't specifically seeking lips. In Chloe's case, she just has a relatively small top lip. Just by adding a very small amount of volume into the lip, we got a natural slight pout that has added a lot of self-confidence. Well, I don't want to say self-confidence. How would you describe it?
It has added self-confidence. That was the missing piece to my face being aligned. So when we corrected my chin to be more in line with my nose, my lips were too small for then the whole side profile.
Lips are often feared by some people because so many people see over-treated results. But as part of a full face assessment, you're missing a trick if you don't look at the lips in conjunction with the chin and the nose. In Chloe's case, she had a slightly weak chin, which we corrected, but then there was a gap between the nose and the chin. That way that the chin and the lips should be in alignment was an easy win to make her look even more beautiful. So a small amount of top lip projection brought all of her profile into a much better alignment. This comes from an aesthetic goal that we had. It's the missing piece, I think, in aesthetics training to develop an aesthetic vision, the potential for your patient. By looking at the full face and looking at each area in conjunction, you will see little tweaks that you can make all over the face, which creates much more beautiful results than if you're simply patient-led. In the past few years, I've developed a framework to help clinicians make aesthetic decisions, not anatomical decisions or filler decisions, but aesthetically guided decisions to help them make their patients more beautiful in a much more structured way. This framework, I believe, is the missing piece in aesthetics training, and it shows you why, not just how to inject. It'll remove so many of your frustrations when you really get this.